Hi, you guys. Welcome back for our daily practice questions. It is day 132, and we are now in our Pharm series. As I did on yesterday, you'll start to see in this series that we are working through each of the systems and focusing in on the medication, drug classes, treatment options to make sure that you not only have the knowledge, but you know how to effectively apply this to these Pharm style questions. I get this so often about preparing for the Pharm portion of it. And I always tell y'all to study it with the system that you're reviewing. So I'm showing you how to take that knowledge that we have already covered and applying it to question formats, okay? But before we get into all this, I always like to start with my introduction and disclaimer. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. All of those resources that I do offer are linked in the bio of this channel. So if you go to the main screen of the Nursing Studio channel, you will see all the links to the things that I have mentioned. But y'all know I always like to go over my disclaimer and reminder really briefly before getting started that we know there's no absolutes in medicine. We treat on a patient-by-patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into question number 1 for today. And don't forget to hit the subscribe button so you do not miss any of my videos. Question number 1 states, what is the first-line antibiotic treatment for an otherwise healthy child with acute otitis media? Is it A, azithromycin? Is it B, amoxicillin? Is it C, ciprofloxacin? Or is it D, doxycycline? Take a moment and tell me what you got in the comments, y'all. All right, you guys, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. Here, the stem is the question. The question is the stem, right? But it states, what is the first-line antibiotic treatment for an otherwise healthy child with acute otitis media? So this is where you need to know your treatment options, right? And when I tell y'all to review those first-line therapy options. Review the second line. Review the alternates in case of allergies, etc., right? But your best answer here is B, amoxicillin. Remember, first-line therapy for acute otitis media is amoxicillin. Question number 2, which of the following patients with acute otitis media may be appropriate for initial observation without immediate antibiotics? Is it A, a 6-month-old with bilateral acute otitis media and a fever? Is it B, a 3-year-old with severe otalgia and high fever? Is it C, a 2-year-old with mild unilateral acute otitis media and no fever? Or is it D, a 12-month-old with bilateral acute otitis media and severe symptoms? Take a moment and tell me what you got in the comments, y'all. All right, so again, in this scenario, the stem is the question. The question is the stem, and it states, which of the following patients with acute otitis media may be appropriate for initial observation without immediate antibiotics? All right, so your best answer here would be C, a 2-year-old with mild unilateral acute otitis media and no fever. And let's talk about why. All right, so we just mentioned in question number 1 that amoxicillin is your first-line therapy option, but in some scenarios, antibiotics are not immediately needed or warranted. And so this is something that you may be able to just observe them and see how they are doing, that watch and wait period, so to speak, right? So let's go through each. A says a 6-month-old with bilateral acute otitis media and a fever. 1, it is bilateral. 2, they have a fever. It's bacterial, typically with a fever associated. So you want to go ahead with antibiotics in that scenario so we can eliminate the source, right, of that infection, right? B says a 3-year-old with severe otalgia and high fever. They have severe otalgia, that ear pain, right? and a high fever. Again, antibiotics warranted. And then D, a 12-month-old with bilateral acute otitis media and severe symptoms. Same scenario. Whereas with C, a 2-year-old with mild unilateral acute otitis media is in one ear. They don't have a fever. They're young. They're 2, and a lot of times children under the age of 2, you do want to wait and see if you don't have to give antibiotics. So these ages do play a key range, but also their presentation. So it's unilateral, they don't have a fever. This may be something that can resolve. We'll watch and wait. But if they begin to have a fever, if we begin to note any worsening, of course, we will move forward with the antibiotic therapy, okay? So again, C is your best answer. Question number 3. A 4-year-old child presents with acute otitis media and a documented severe reaction to penicillin. Which of the following is the most appropriate antibiotic choice? Is it A, amoxicillin? Is it B, cefdinir? Is it C, azithromycin? Or is it D, augmentin? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question here states, which of the following is the most appropriate antibiotic choice? So, all right, we're looking for a treatment of an antibiotic choice, right? And y'all know I tell y'all, if the stem of the question is asking for a treatment, you need to run it back and look to see if they have provided you with a diagnosis. If they have not, you got to run it back a step further and look at those assessment findings so that you can determine the diagnosis, because we got to know what it is to be able to treat it, right? So here the diagnosis is included. It shows you that the child has acute otitis media. They also have a documented severe reaction to penicillin. So this lets us know a few things. One, we're looking to treat acute otitis media, but we know amoxicillin is first-line therapy for acute otitis media. But the little child has a penicillin allergy, so we can't do that, right? So you want to go ahead and eliminate amoxicillin. Also, it states that it's a severe reaction to penicillin. And remember, the penicillins and the cephalosporins, what I tell you, they're sisters, they're cousins, they're related, they're family. However you want to remember that, they are related. So if one's a problem, the other one a problem, okay? We don't fool with all of that if we already have an issue with one, right? So if you have a severe reaction to penicillin, their family of the ceftinirs, and this is why severe anaphylaxis, any of those terms, if they put that in the question, is letting you know it's that bad that you don't even need to deal with anything in the family, anything that's related. So no penicillins clearly, but no cephalosporins either. So you can eliminate ceftinir also. Next, D, augmentin has amoxicillin, and I put it here like this because I want y'all to understand and remember that augmentin is amoxicillin plus clavulanate, okay, or clavulanic acid. You may see it both ways. So that still is a penicillin component. You do not want to include it. Your best answer is C, azithromycin. Also, remember, if you have ever listened to any of my reviews, and also when we worked through EENT previously this year, with just the knowledge base and presentation style questions, I always tell y'all Brittany's brilliance for acute otitis media is to think of the A's. A for acute otitis media, A for the first line therapy of amoxicillin, A for the second line therapy of augmentin, and A for azithromycin, your third line therapy, if these other two have not worked or if they have a penicillin allergy, right? So this is what I mean when you're studying these things. I want you to review in this fashion. So however the question is delivered to you, you can pivot and get it correct. This is why when I work with reviewers or we do question analysis sessions, this is how I'm helping you to fill these gaps, because we're not leaving room for error, right? You have to know how to study effectively and work smarter, but not harder, right? So I want you to walk yourself through it. I tell y'all these things: assessment, diagnosis, evaluation, and treatment, and making sure you walk through those first, second line, and alternate therapy options for your treatment. And this will cover you throughout. Okay. But all right, you guys, that's all for today. As always, I hope you found this helpful. Please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio1@gmail.com. Again, everything that I offer is linked in the bio of this channel. And as always, if you're looking to book any of my one-on-one sessions, any of my custom packages or plans, or any of my question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.